Hi, everybody. It's Dr. Laura Hanson with Connect My Brain. So glad that you're here. We're starting a new series, and this one is going to be called Collaborative Healthcare. And we are going to be looking at or listening to, whether you're looking at it on YouTube or you're listening on Apple or Spotify, we're going to look at this idea of what it means for other professionals to come together and collaborate on a patient, or what it may mean inside of an individual office. So my practice for 26 years has been an integrative approach. And so what that means is that I'm going to look at the entire person. And you've heard me say my 3-tier approach is mechanical, chemical, brain. So what that means is that I am integrating many different modalities and therapies in order to work with an individual. And that's why I went after so many different credentials as well. So while I am a doctor of chiropractic, I also have my master's in nutrition. I am a pediatric diplomate. I am board certified in neurofeedback, and I am a neurodevelopmental therapist, and I am a certified autism specialist, and I'm currently obtaining my diplomate in reading QEEG, which is the raw data that is generated from doing a brain map. So this is a collaborative or an integrative approach. So while a chiropractor may only utilize the chiropractic adjustment, I have gone on to get many different credentials so that I could do many things in order to make sure that I am addressing everything that's going on within my scope, everything that's going on for that patient. And that was something that came to me early on as a chiropractor. I can remember this little girl that when she would come into the office, every time she heard my voice, she actually was screaming. And I had no idea at the time why. And it literally caused me to whisper when her and her family would come into the office. But it also got me thinking. Back then, it's so funny to me. I didn't even have like a private office, so I never spoke to anyone in an office setting. I always used a room because back in my office were all of my books just open. I could never get enough books. And if you've ever come to this office, you could see the library that's here is the library that's at the office, but at my apartment, there's another library. I love books, and I don't want to read online. I want to hold that book. I want to turn the page. I love being a life learner. And I know that's why I also have so many different credentials after my name. I just can't get enough information. So when I was scratching my head trying to figure out what am I going to do, I can't get near this child. How can I use the tool that I have been taught and licensed for? How am I going to adjust her if I can't even touch her or get near to her? So it wasn't just an auditory issue. It was also a tactile issue. Now, some chiropractors use instruments like an activator, and I couldn't even use that because the activator makes a clicking sound. So sound was really prevalent for this child. So I have to tell you, this was the beginning for me in learning how the nervous system actually gets wired up. And so there is a developmental progression for sound. When you come into this world, you primarily hear low frequency sounds. And you have a membrane analyzer that lays down on the cochlear inside of the ear. And that low sound is what's organized at the base or the outermost part of that membrane analyzer. Over the first 3 years of life, that is the development of sound. This is also why children can learn a second language so much easier than an adult can, because they're in the window of development. So the first 3 years, all of that sound is going to get laid down. And we hear over 20,000 different frequencies of sound, and they are going to get laid down on this membrane analyzer. But not only do they get laid down, but the low frequency sound, what I would tell you, my perception is that it's almost like it's grabbing the sound and it's pulling it through the analyzer, because the low frequency sound ends up on the apex of that analyzer, and the high frequency sounds are at the base. So there's reorganization while different frequencies of sound are being laid down, as well as what is also going on is we're moving from a brain stem to a midbrain to a higher brain. So there is a lot that's going on. And so understanding the progression of the development really was my very first step in going in the direction that led me into being an integrative practitioner. Now, in chiropractic, we talk about the vertebral subluxation complex, meaning that there are many components that are feeding back. And let's keep our words, feedback, like we talk about with neurofeedback. We are a feedback mechanism. So there is feedback going through the spinal cord that is literally going up to the brain. And it can be a movement piece. It can be a nerve piece. It can be a muscle piece. It can be what we call a histo or tissue chemistry. So that's where I come up with this idea of the chemical piece that leads to the fifth layer. And the fifth layer is where you've got the problem, or what we term pathophysiology. And so I started looking at those components of the vertebral subluxation complex to really look at the kids or the adults at that time that were coming into my office with really some interesting complaints or issues. And that is how I started to approach it. And then it led me, well, okay, I need to know more about this neurological piece. And that's what led me into becoming a pediatric diplomate, which is 3 years after becoming a doctor of chiropractic. It was an intensive study in learning about pregnancy and babies and children. Then I was asked to teach in that program, and I was asked to teach neurology. And I thought to myself, okay, well, let's just go right to the top of everything. But the way we learned it in school was very linear in my perspective. It was like the vestibulocochlear nerve. Okay, so the vestibular cochlear nerve goes from the vestibular system to the cochlear system inside of the ear. And so it was very linear. And I knew that neurology had to come alive, because this is everything. And in chiropractic, we always talk about being nervous system specialists. So I really wanted to teach a program that would begin to enhance the doctors to understand the depth of how this nervous system gets wired up, and why looking at children when they're in these open windows of development is so paramount to how their lives are going to be, from the day you get to work on them, but really from the day of conception all the way through. So that's when I became a neurodevelopmental therapist. And I have to tell you, this really changed my perspective, because the program that I went through was completely on the reflex system prior to the birth of the baby, as well as prior to the sensory motor connection. So oftentimes you've heard me say you come into this world fully formed, but you are not fully functioning. So down in your brainstem is where all these reflexes originate, but they're with you forever. Now, they're not supposed to be dominant, but they are there as the rudimentary training ground. They're also known as central pattern generators. You've heard me say the word pattern over and over and over again. As a human being, we are pattern generators. The brain is always looking for the pattern. So this is at the core of how we get wired. But when I took this coursework and I learned about the reflex system, it just completely blew me away at how much information I actually did not know. And one of the real benefits of my chiropractic education was that they taught us to be very resourceful. So even though we may not have, let me rephrase that. We have been exposed to every single part of the human body. We have had immunology, we've had biochemistry, we've had histology, we've had psychology, we worked on cadavers, we had dissection lab. The list of coursework is endless. And this is why chiropractors look at the entire body. We even had pharmacology. And I would say one of the things I do feel strong about, and not all my colleagues agree with me, I really wish we would go forward and get the rights to prescribe medications, because if we did, we'd have the right to take you off of a medication. So it's not that I want to prescribe medicine. I really don't, because I think there's just so much that you can do for the body holistically. But I do respect that medications are there. But I've had a lot of experience in 26 years where I have seen people on so many medications from so many different medical providers, and nobody is communicating with each other. I can remember one woman in particular where her family came to me and asked me, would you look at our mom? Because we're really concerned that her memory is going and she really doesn't seem like herself. And though I am not the person to take her off of any medications, when I looked at her medication list, she was on 14 different medications. And there was about 7 different providers within that circle of influence. And nobody was talking to each other. And so I took a role as a liaison, and I called every single one of those providers, let them know what the family was going through and what I had even noticed about this particular woman, and got them to look at the entire list of medications. And what ended up happening was she was reduced down to 4 from that simple step. So even though we do not prescribe medications, I would like to have the opportunity to maybe influence what people are taking. That's not principally my role. But I do think it is important that as chiropractors, regardless, we should know what people are taking and why they're taking it. I feel very fortunate to be doing neurofeedback and brain mapping in my office because medications completely influence what the brain map is going to look like. And sometimes people put things down on an intake form and sometimes they don't. And so by knowing what is a particular medication going to do to a brainwave, it is literally going to help me as the clinician to look at the patient and say, are you on medication? What are you on? And be able to write that down. Now, I've also said over and over and over again that neurofeedback will actually make medication work better because you are influencing the brain waves, and therefore that individual can then go back to the doctor that prescribed it and have that conversation. There's many providers that are prescribing medications to my patients, and we have such an open dialogue. And I think that's where this idea of an integrative or a collaborative approach is so important, because the thing that's in the middle is the patient. And I don't mean saying disrespectfully, but sometimes I think clinicians miss that point, and they're working so diligently either on their own or they don't want to collaborate. And you could just have so many things going on in a patient's life. And it is so important to know that, so that you've got the whole picture and therefore you can actually help manage it. But the communication is key. And I think as chiropractors, we've had such an opportunity to learn so many different things that it's important for us to keep that big picture idea. Now, I think it's great. My colleagues that want to just utilize the chiropractic adjustment and that's it. That's fabulous. That is their focus and that is what they want to do. But there are chiropractors like myself who it's a drive, it's a motivation, it's a passion, and it's the way that I'm wired. I'm wired to connect dots. I think that's the easiest way to say it, which literally led me from that little girl who was so disrupted. Her nervous system was so disrupted by tactile or touching and sound that I couldn't use the trade of my license to even get near her. And so I started from understanding how this nervous system gets wired up to diving deeper and understanding what is influencing this child's nervous system right now. And I started looking at it from a neurological perspective. So I tested her auditory pathway. And in chiropractic school, we learned how to do two tests called Weber's and Rhines. And we are looking at bone and air conduction. And this test allows you to look at how the sound is being perceived by the individual. And so I got 3 tuning forks, one that represented low frequency sound, one that represented middle, and one that represented high. Now, I would say it's not the most objective test on the planet, but it allowed me to look into her nervous system. And so I found skewedness. So the first part of the test, you're trying to see, can they hear equally out of both ears? And that was the greatest deficit I learned. She could not perceive sound in her right ear as she could in her left ear. And it was at all three frequencies. And so from there, I literally referred her to an audiologist. And I got to tell you, 26 years ago, I thought audiologists just rocked. They had such an incredible way of really looking at the perception of sound. And they looked at every single frequency. So just as I said, this was not the most objective test because I wasn't looking at every single frequency. So what I needed to do is I needed to have somebody look at those frequencies so that we could determine the ones that she could hear and the ones that she couldn't. And that became a step in a new direction. And this audiologist literally made a CD of sound, which if you don't know what a CD is, because we hardly even use them anymore, a compact disc, but it was on the frequencies that she could not hear so we could begin to retrain her ear. Now that led me to finding a piece of equipment that I could use in my office. And I use what's called the integrative listening system. And back then I was talking to the owners about what I really wanted to do with this piece of equipment, which allowed me to get one of their pro systems, which would enable me to put sound in one ear over the other, which led to the next thing. Oh, well, I found this thing called lateralization, and she's definitely over the age of 3.5, 4. I want to see, did her brain get organized? And literally the ear was on the opposite side of her eye, hand, and foot. So do you see where I'm going? This led me down a path that helped me really learn how to evaluate developmental progression and to see exactly how an individual child would have gotten wired up, which today has opened up a door to where we have literally put together an entire program that is centered around looking at those individual pieces, putting the concept of the brain into action so that we have an intensity and a frequency that is going to push the brain to change. So I have been very fortunate over the years to be exposed to all the different things that I have been exposed to, which has led me down this path that has enabled me to have an integrative practice that looks at the entire picture. And I have to tell you, it literally generated the intake form that I have today, which is about, I think it's about 8 or 9 pages, because it's the blueprint. It's the blueprint of how that individual got wired up. And it really focuses, especially for children, on the developmental milestones. You know, back in chiropractic school, I really thought, from a holistic point of view, that everybody just got wired up in their own space and time. And when I learned about the developmental progression, the developmental milestones are signposts. They are things for us as parents, as well as clinicians, therapists, school teachers, anybody working with children, to understand that we know that there is a time for an expected development, integration, and function, and we should be looking for them. So, for example, I mentioned lateralization. Lateralization should happen around 3.5 to 4 years old. That is the dominant eye, hand, foot, ear, all on one side, reflecting on the organization of the brain. Then we should also be communicating as babies. Within the first couple of months, you should be making vowel sounds. As a 4-year-old, you should have reciprocal arm swing. At 12 months, you should be getting up on your legs, and they should be in a little bit of a bowed position, not turned in. There's all kinds of signposts that tell us that we are going in the right direction. You know, there's a great program, Babies Can't Wait, but babies really can't wait. And waiting to see if a child grows out is literally changing the trajectory of the way that child's brain is going to experience those number of years that it's on the planet and how it is going to get wired up. Now, over on the website, over in the podcast section, there are show notes, and there is a developmental milestone summary page of what I think are the top ones, just to give you a glimpse into this, that you can sign up for a free download of these milestone guidelines so that you can have them for yourself. And especially if you are a new mommy or you're a teacher, today our kids are really going through a lot, and we all need to keep our eyes on them. So please go over there and take a look and sign up for that guideline. Now, you can also take your practice. I have been an individual practitioner for 26 years. I have to tell you, I really don't like practicing like an island. I've been trying for probably 4 years now to bring some other providers in, and I've talked to a few over time. But recently, I have decided to take a step and join a group of doctors and therapists that are at the top of their game, second to none. And we have really pulled together a collaborative effort. So I have a second office now, and that second office is in Roswell, Georgia, which is up the road. And the name of the practice, which we have all agreed, we're not bringing in our individual practice as if we are individual units under one roof. We have come together under the name Brain and Body Rehabilitation Specialist, so that we demonstrate to the community that we are a collaborative effort to come together in order to provide the best care to our community. And these are chiropractors who have specialized in neurology. We have a kinesiologist. We also have an occupational therapist specializing in vision therapy. And many of us do integrative functional lab testing. Of course, I'm doing my neurofeedback up there. And one of the things that I think all of us just feel incredible about is that we all honor God and the spiritual aspect to everything a human being goes through. So there is a prayer room as well as our prayer minister, and her name is Jennifer. So we have looked at every aspect of what an individual is going to need, and we have put it together under one roof. So what's really exciting, we actually have 2 OTs, and our second OT, Kendra, she is specializing in pediatric care. She's my next door neighbor up there, and she does all kinds of rehabilitation for children. Now, what I'm going to do over the next few weeks, because I just think this is so important for my podcast community to also learn about this, in case you want to come to us or if you might look for something like this in your area. But what's so interesting about each and every one of us is we all have people travel in to see us. So we always want you to feel welcome regardless of where you are. And you can always reach out and have a personal conversation so that we can help you figure out if it's a great fit for you. But what I'm going to be doing over the next few weeks is I'm going to be interviewing each and every one of them so that you can learn about their specialty And if you want to send in questions ahead of time, please feel free to do that. And even if you send in questions, just depending about how the podcast community responds, if I start getting a lot of questions, maybe what we'll do is a podcast that's just a Q&A. So whatever way works for you, please reach out, because we want you to be part of our community and we want you to get the best care possible. And when we take an integrative approach, the patient is in the middle and every single part of that patient is being evaluated. You know, many years ago, I came up with a style of a report of findings that I would do with a patient. The patient is in the middle. Their chief complaint is under that. Their past medical history and family history is under that, but it's all in the center. It is the patient's blueprint. Just like looking at children and looking at their developmental milestones, when the acquisition for those goals or acquisitions of those particular areas were accomplished, is their blueprint. But what was around the center was the immune system, the cardiovascular system, gut health, mechanical, spiritual, the endocrine system, and the brain. And I would take everything that they were going through and I would literally list it underneath those particular systems so that they would understand how far-reaching what they're going through is impacting their health, or vice versa, depending upon what the situation is. How what's going on in those systems is impacting their chief complaint. You were knitted in your mother's womb. You are well organized. This is a beautiful symphony that is meant to work together. All the parts. My tagline for Connect My Brain is to be transformed by the renewing of your mind. I hope that the podcasts that I put out there are opening your mind, that there's so many things that you can consider when you are thinking about how do you want to direct your health care. Connect My Brain is here for you, and so is Brain and Body Rehabilitation Specialists. Look up both of our websites, connectmybrain.com, and our other website is BBRS.com. You can always reach out to me. The phone number at Connect My Brain is 678-501-5172. Make sure you subscribe to the podcast. Go over there and download the developmental milestone chart, and make sure you share this with a friend. Be blessed, take care, and we'll talk next time.